But yeah.
We have time for one more question, Charlie.
I just wanted to ask if you had any comments on driving safety or the literature on driving safety.
Oh, I think the literature on driving safety is clear that if you drive while intoxicated with the substance, because for all the reasons that are given about how it affects coordination, etc., reaction, you're more dangerous. However, there's also sort of a parallel literature that says because, again, using the vernacular, you're stupid, you're less likely to drive. And if you do drive, you're going to drive more slowly. So that's a little bit distinct from something like alcohol, which just inhibits you to drive stupidly and fast, as opposed to slowly and not at all. You know, again, it's not I don't mean it to be a dodge, but that's what we've heard.
I'd really like to thank you. I'm trying to be respectful for your time.
Yes, that gentleman's going to
Okay.
dive on answer his question.
Sure, I mean, are you doing any personal experiences with these users, or is this an academic study?
This is an academic study.
Concerned
But
about prostate cancer patients, people
no.
like that? I mean, are you involved with the actual patients that have
No, I'm
these?
not, because I'm in a state in the country where I can't do that legally. No, I'm not. I told you, I wrote this piece as a journalist. I was a journalist before I went to medical school. And out of a family situation, I wanted to learn more about this. So I'm one of those people who's trying to synthesize rather than come up with new information. Mayo Clinic does no research going on, I don't believe. There might have been one study at one point. But there is nothing happening, and the institution is not taking a stance on this, but they are not allowing it to be prescribed in Arizona, which is a legal state. So this is my effort to try to understand. It's not, I'm not presenting anything new, except for hopefully a new synthesis.
Thank you very much for coming. I don't want your pager. I don't want that.
Thank you.
Thank you very much, and I appreciate people being respectful of his time commitment. Found that enlightening, and I think that, Charlie, your comment, he did not really look at the public safety side of this, which has been a problem in other states as well, of how do you determine driving under the influence when you don't have quantitative testing available in the same way we do for alcohol. And the presence is there for so long that a positive can last for several weeks, where alcohol is out of your system in a short time. And I think that public safety side of things has not been thought about as many places as we'd like, and well, certainly it's happened in those states where it's been legalized. The work comp environment of a positive test influencing work and things have all been there. I'd like to next introduce Eric Dick, who is the MMA's Manager of State Legislative Affairs, and I want him to kind of provide an overview of what's happening at the state level right now and what the legislation really means and what we're talking about here from a legislative perspective and what MMA's opportunities are.
This simply can't be done in a quiet fashion, I'm sorry. Thank you, Dr. Thorson, for the introduction. Thank you for having me tonight. With the session having started last week, it's an absolute treat to be away from the Capitol for a night, so I am grateful for the opportunity to come join you. As Dr. Thorson suggested, I am one of the two lobbyists at the MMA. My colleague, Dave Renner, who many of you know, is actually at the Capitol, actually watching the first hearing for this very bill that's moving forward. We've been joking that we would break to a live feed as Dave reported from the Capitol, but the link up didn't work. So I will give you a lay of the land here in Minnesota and hopefully be able to answer some questions as we go forward. As the slide suggests, the two bills that are being considered this year were introduced actually at the end of the 2013 session. That's not an unusual thing that happens at the Capitol. When a legislator or an interest group wants to put folks on notice that they're going to be pursuing a bill, they'll often drop it in the latter days of the prior session. Of course, 2014 is the second year of the biennium that we're in. So the two bills that are moving this year, or likely to move, were actually introduced in 2013. The House file is House File 1818, and it's being carried by Carly Moline, who is from Hibbing. There are 30 sponsors on the bill, which is a big number. on a house jacket, as they're called, you can fill it up. And to see 30 names is a pretty broad suggestion of support. Also of note, it's not all just Democrats. There are a handful of Republicans, so it is in fact a bipartisan bill. The Senate author is Senator Scott Dibble from Minneapolis. In the Senate, the rules are a little bit different. You can only have 5 co-authors, 5 authors on a bill, though it's notable that the second author from Andover is a pretty conservative Republican, Brandon Peterson. What's notable about the multiple committee stops that I mentioned is that this bill will change as it moves forward. By my read, it's starting tonight in HHS, the Health Committee. It will certainly go to Civil Law, which will deal with some of the public safety issues, Judiciary for the courts, there's probably a state and local piece, and potentially even a commerce piece. So, long story short, this bill has many stops, as they say at the Capitol, and it will change at every stop. It's a rare bill, and it's a remarkably uncontroversial bill that gets introduced, goes through the process without changes. A bill like this will see dramatic changes as it moves forward. As I suggested, we're in the second week of session right now. It feels a lot like the end of session from my perspective at the Capitol. The pace is as fevered as the end of session is. That's because we started late this year. Generally speaking, in the second year of a biennium, we'll start in early February. This year we're starting at the end of February. And House and Senate leadership have set very tight deadlines for bills to meet certain markers. It's a way in which leaders will help weed out bills that are not moving. So, long story short again, bills need to pass one body or the other by March 28th. So, long story short, relatively short, this thing has to get heard. It has to get heard quickly. Just by way of history lesson, it's not the first time this has been up in Minnesota. In fact, a medical marijuana bill passed both bodies in 2009. The Democratic House and Democratic Senate passed bills, and it was vetoed by Governor Fuente. So we've been down this road fairly recently. As Dr. Boswick noted, you all wouldn't be asked to prescribe under this bill for obvious reasons related to federal law. What the bill allows for, though, is a practitioner to offer their certification, and this is the language right from the bill, that in the practitioner's professional opinion, the patient is likely to receive therapeutic or palliative benefit from the medical use of marijuana to treat or alleviate the patient's debilitating medical condition. We'll talk about those medical conditions in just half a moment. In an effort to avoid what many have seen as a bit of a disaster in California, this bill would require a full physical examination and an assessment of a patient's history. An interesting wrinkle for pediatric patients, it would require 2 practitioners to certify that the patient would receive some benefit, therapeutic or palliative benefit. Also, as you can see by the asterisk, doctors of medicine, osteopathy, and PAs acting within the scope of practice, and APRNs would be allowed to act as certifiers, so to speak. The bill lays out very specific pieces that would allow the patient to be eligible for the certification. In addition to the specific diseases you see before you, cancer, glaucoma, AIDS, Hep C, ALS, PTSD, and Tourette's, it also lays out conditions or chronic diseases that would lead to the following conditions: the wasting diseases, severe pain, not severe pain, nausea, seizures including epilepsy, MS, and Crohn's disease. It also makes a specific allowance for physicians and practitioners to recommend for HIV. And it also sets up a system by which conditions or diseases could be added to that list. That would be governed by the Minnesota Department of Health. It's a public process, and it would go through rulemaking in that case. The bill offers a number of legal protections for physicians, or one specific one. Were you to recommend the use of marijuana, you would not be subject to arrest, civil penalty, or discipline from the BMP, though it carves out a couple of cases in which you would be subject to penalty potentially. As suggested here, there's no protection for failure to properly do the assessment, to properly take the history that's required. And also of note, again, probably a nod to California's scenario, criminal penalties are established for practitioners who refer to a dispensary in which they have a financial interest. So almost a stark law, so to speak, for medical marijuana. Practically speaking, the procedure by which a patient would get the drug would be, first step would be to receive the written certification from you. The patient would take that certification to the Department of Health, and they would do some small background checks, and they would be issued a card with their name, address, a unique identifier, things of that nature. The bill establishes a program by which a family member or a community member could serve as a caregiver. The caregiver would be responsible for storage and purchase of the product. Caregivers are capped at 5 patients per, so it couldn't become a small business, so to speak, of being serving as a caregiver. The bill establishes medical dispensaries. This is some of the, not unlike some of the images that we saw from Dr. Boswick. The bill, again, is very careful to try to avoid the problems that came in California by limiting the total number that would be available per county. I don't off the top of my head know what those are, but again, in California we hear the reports of dispensaries in every strip mall, on every block. The authors of the bills are very careful to avoid that scenario. Not unlike the prohibition I spoke of earlier, dispensaries would be prohibited from setting up shop in your clinic. And there's no on-site use of the drug. So dreams of the Amsterdam coffee shop, unfortunately, aren't going to come true under this bill. There is a provision that would allow for a patient to grow their own in their home. It sets up different regulations on safety of the facility and whatnot. Most advocates for the bill will tell you that's unlikely to go forward. It's horribly problematic from a safety standpoint. Law enforcement hates this piece, and it's likely to be dropped if this moves forward. The amount of marijuana that is available for a patient to possess at any one time is 2.5 ounces or 12 plants, and I checked the definition, as Dr. Bostwick noted, it is only the flowers, or I guess the buds of the plant, so stems and seeds and stalks don't count toward that 2.5 ounces. As is always the case in a bill of this scope, there are lots of other pieces. I focus mostly on those that would most directly affect you, but the bill bars the use in public places, on transport, in schools, things of that ilk. There's no protections allowed for somebody who's operating while intoxicated, a boat, a car, a train, a plane. It actually includes in the bill, so hopefully that's some comfort to those flying. If you are caught lying in the application form or falsifying documents, your registry card can be revoked and it will be suspended for X amount of time. I think 2 revocations and you're barred for life. It sets up provisions around use in nursing facilities, which is an interesting piece of the bill. It also prevents discrimination against card holders. The politics of medical marijuana are an interesting bunch at the Capitol. As I suggested earlier, this is a bipartisan bill in both the House and the Senate. There is also bipartisan skepticism or downright opposition. It makes for strange bedfellows. I mentioned Senator Peterson earlier, who's the second author on the Senate bill. Senator Peterson is considered probably the most true libertarian member of the Senate. He supports this bill. The Senate author, Scott Dibble, is considered by many to be one of the more liberal members. So again, it makes for strange bedfellows at the Capitol. If you followed this at all in the news as we've gone forward, the role of law enforcement is a really interesting one. Governor Dayton has long enjoyed the support of law enforcement, going back to his first run for state office, for his U.S. Senate run. And he has consistently stated that he won't support a bill that law enforcement objects to. We'll see if that stands true as we move forward. He has left open ever so slight wiggle room on that point, but it's a pretty narrow gap to squeeze through. All of this is taking place in the context of elections that are looming in 2014. Making things somewhat more interesting is that many would presume that it's all DFLers, they all get along, it's all easy. That ain't the case at all. What makes this so interesting for those of us who like politics is that the Senate agenda may well be very different than that of the House and the Governor, because the House and the Governor are up before voters in 2014. The Senate isn't up until 2016. So they've got a little longer time frame to look at these issues. So it's something to follow not only in medical marijuana, but in the tax bill, in bonding. It's an interesting dynamic, all in the family, in the DFL family here, maybe not always so happy. There has been more discussion, as we've seen in the last several weeks, about a potential for some compromise that law enforcement could support, specifically related to an oil, maybe that is contains no THC, but contains the other elements that might provide some relief. You've seen the story of a young girl who was suffering from terrible seizures, who found relief from an oil of this sort. Interestingly, I was checking my Twitter earlier. Twitter's the lifeblood of us at the Capitol. It's terrible. But interestingly, there was the first testifier tonight was that very family. It was a family who has a young girl who found relief from this Charlotte's Web strain of marijuana. They're saying if they can't get it here in Minnesota, they're going to move to Colorado to find that option for their daughter. That was the first testifier tonight. So we'll see if law enforcement can get there. That is from what I've been hearing from some of my colleagues in the lobbying community who represent law enforcement, that opening it up for just this one type of drug is really, really difficult to administer. It's really problematic. And on the other side, I think the proponents of a broader bill are feeling wind at their back right now. They've got great momentum. There's great publicity. Some of the polling seems to suggest that this is growing more popular, and more Minnesotans are becoming more comfortable with this. So it will be interesting to see as this goes forward. As I suggested, the bill is up for its first committee hearing tonight. I can't tell you what will happen, if it will be substantially amended. I doubt it. Though I will also tell you that they wouldn't be bringing it up tonight if they didn't have the votes to pass it out of this first committee. So watch for some news tomorrow about if and how that bill got changed.
Which committee is it in tonight?
It is in the House HHS Policy Committee. And finally, I'm happy to take any questions. Great start there. Dr. Stoicki.
Yeah, Eric, in 2009 when this passed, did the MMA take a position for or against at that time?
It was before my time here at the MMA, but I don't believe that is the case. I think our
Took no position.
took no position.
If I remember right. It's not before my time, but my memory is worse, so I think it was no position. Do you remember, Janet? Okay.
And just so you know, for the sake of capturing it all, we're trying to run around with the microphone as you have questions, but I don't know how great that's working. So should we just cut?
Maybe ask the speaker to repeat the question.
What is the official position from the MMA right now?
The purpose of this policy forum is actually first steps in helping us try and develop a position. And the feedback we get from here, as well as feedback from constituent groups and a multidisciplinary approach that we've reached out to other professional associations, will help the Board of Trustees develop a position for this and be able to take that to the legislature. Because we're being asked, what is MMA's position? And we've got that on a fast track. We currently have no position, that's right.
What's interesting on that point is Dave and I will go to meet with legislators on our agenda to talk about our position on the APRN bill or PPG or our effort to ban tanning for minors. And oftentimes legislators will say, yeah. What do you think about medical marijuana? Which is really interesting.
You know, I was saying earlier that we've got all these really important things that are out there as well. In the past 3 days, I've been interviewed by NPR, KSDP, WCCO, the Star Tribune, and a national news service about medical marijuana, none of these other things. So this seems to have a certain public interest that other things don't have.